That was our pre-event coffee break. Some folks came on a few minutes early. We decided that we wanted to get warmed up. We've been doing these Zooms for a while now. We wanted to get a little warmed up ahead of time and invite people to join us and listen to a little music and trying something new. So thanks to everyone who came early. And if you're on future Zooms, plan to pop in a couple minutes before we start. My name is Laurel Hansen. I'm MACC's program manager. Hopefully you can hear me well. I am joined by my co-moderator, Clara Owens, the communications director at MACC, and we're just really happy to be here with you today for this event, which is MACC Zooms in on fall planning and preparation, something that I think we're all deep into right now, fall and winter planning and prep. So this, as I mentioned, this convening continues the series of Zoom sessions that bring MACC members together during the COVID crisis. We're trying really hard to listen to our members and convene them around the issues that matter to them. While each of our members has a distinct voice in the community, we know that our network is united by a belief that we have a greater impact when we partner and collaborate with each other. So this is a great opportunity to do that together. So on behalf of your network, MACC, thank you very much for being here. You can see the agenda in front of you, and I just want to share a couple directions and a little something new as well with you. So if you've been on these Zooms before, you know that there's lots of different ways to participate, and you can also access them afterwards. So if you have a colleague or a staff person that you wish had been on the Zoom with you, we've launched a YouTube channel called Zoom In On Demand. So watch the E-Goodie Bag that you get after this session for a link to that. You can also, during the session today, participate in the chat box and also in the Q&A and hold up your hand, all of those things that work so well. Another new thing that we've launched in a way that we really want to listen and know what you'd like to Zoom about, we launched a virtual post-it wall. And you can pop in there, and when you think of something, when it comes to your mind, what do you want MACC to host a Zoom about? What would you like to talk about with your network? That's the place to drop us a post-it note on the wall. You'll find a link to that in the E-Goodie Bag later today as well. And of course, you can email any of us as an alternative, but I think you'll enjoy that new feature, the promo wall. Awesome. So there's so many great organizations represented today in this event. You can see all of the member logos represented in this slide. If we had time, we'd do full introductions for everyone on the Zoom, but in the interest of time, check out who's on the session today, who's registered, and then feel free, if you'd like to, introduce yourself in chat, especially if you haven't been Zooming with us already. We'd love to meet you, and chat's a great way to do that today as well. So before I introduce our guests, just a little reminder about the how-tos. I mentioned chat. You can put your comments and questions right in chat at any time, whether it's a question for a guest or whether it's a technical question. There's also that Q&A window, I believe that is available, but if it's not, the chat window works well too, and you can raise your hand. Clara and I will be watching for that if you'd like to ask a question verbally. So those are the options, and this is meant to be a discussion, so please take advantage of the options to participate. All right, well, I want to move on to introducing our guests because I just feel so lucky and honored to be able to introduce Gretchen Musicant. Gretchen is the Minneapolis Health Commissioner, where she oversees the Minneapolis Health Department, whose mission is to improve the quality of life for all people in the city by protecting the environment, preventing disease and injury, promoting healthy behaviors, and creating a city that is a healthy place to live, work, and play. Prior to working for the city, she was Vice President of Community Health for the Minnesota Hospital Association and a Government Affairs Specialist for the Minnesota Nurses Association. So as you can see, her expertise is just so relevant right now, and we're just very lucky and honored to have her join us. She's going to spend, I don't know, 10, 15 minutes with us, and including time for your questions. And she's graciously offered to share some thoughts about what they're doing in Minneapolis to prepare for the next phase of the pandemic. So good morning to you, Gretchen. Can you see and hear us well this morning?
Yes, thank you.
Yeah. I can only imagine the pressure that you are under. I mean, even in a normal year to project what is going to happen, it can't be easy. And now in this COVID year, it's just must be an unbelievable responsibility. And then unless you're a psychic and have a window to the future, I know there's got to be a really interesting process to how you address this need to sort of plan and project, which all of our organizations are trying to do right now. So thank you for being with us today and telling us a little bit about your process and your story. We appreciate it.
Great, thank you so much. Thanks for the introduction, and thank the members of the organization for really the essential role that we are all playing together, helping to get through this time of economic insecurity, issues of food access and housing, stress, and the challenges that come from all of the changes we've incurred to our mental well-being and even our social cohesion and connectedness. So there are just so many roles to play. There's certainly certain roles that get assigned to folks with the word health in their organization's name, and I'll talk about my thinking through that lens, but I want to acknowledge that it's taking all of us to get through this, and it's affecting all of us and all the people that we work with. So something that's top of mind for us right now is vaccines, and vaccines for two things. One is seasonal flu. And we want to make sure that people are thinking really in a focused way about their seasonal flu vaccination approaches. It's going to be so helpful in making sure that our hospitals are not overwhelmed this fall, and in helping to sort out symptoms and keeping people on the job when we need them the most. So please emphasize the need for seasonal flu vaccine, even as we hear a lot about COVID vaccines and their development. And we're certainly looking into the future for that. We're thinking about what kinds of mechanisms we will need to use for making that available to people, to have vaccine clinics, in addition to probably having vaccines that are available in pharmacies and in healthcare settings. We know that vaccine development is slow. It's not instantaneous. So even when you have a vaccine, you don't have enough for everybody right away. And so there are going to be some issues about who has access when. Having said that, actually my biggest concern when it comes to COVID vaccine is how the community will feel about them. And will they trust this new device, new mechanism that is designed to help protect their health? And I think all of us have some cautionary thoughts, given all the mixed messages that are out there as the vaccines continue to be developed. Some of us are more likely to gain trust quickly than others. And I think those who are slowest to regain trust are actually the folks who maybe we want to get the vaccine the most. And so we're trying to think about how do we kind of co-create our journey into this COVID vaccine opportunity, working with community members to learn together now while things are still unfolding, so that when we get to a point where there is vaccine, we have people who feel grounded in having learned about the vaccine and can be ambassadors to their community as their community has questions that need to be answered. So I think that's a real challenge ahead of us. Not only we want the vaccine, of course, but we want to make sure that it's also something that people will avail themselves of when it is proven to be safe and effective. We've heard over and over again some of the basic messages about wearing masks and social distancing and being outside is safer than inside. And of course, in the fall and the winter, we're going to be inside. And we really haven't had to grapple with widespread COVID infections when we needed to be inside. So I think that will be a real challenge for us and might even curtail things that we've been able to do using that outside opportunity. The other thing that's happening with that message is people are fatigued by it and can't hear it as fresh anymore. And so we really need to keep thinking about new ways to deliver our messages, new messengers who can speak from their experience or are credible to various groups that have grown tired of hearing the messages that are out there right now. As you, I'm sure, have heard, the outbreak is now really focused in on young people and young adults. And that's troubling for a couple reasons. One is that that age group still hasn't fully developed their frontal lobe of their brain, and consequences feel different to that age group than they do as our brain continues to develop into adulthood. They're also often the frontline workers in many of our endeavors, and so are not only exposed in their own peer groups, but have opportunities to expose others beyond their families. And so that's an issue that is troubling. The positive side is they don't appear to have very, very serious consequences, although we're still learning about what the long-term consequences of having the COVID infection might be. So in Minneapolis, like Minnesota, we are still in a category that folks are saying is accelerating spread. So we are by no means on the threshold of being under control here in Minnesota. And we have been at this plateau, this high plateau of accelerating spread for several months, and have not been able to bring it down. It hasn't grown to a heightened peak that maybe we saw in some of the western states and the southern states, but we have stayed at this high plateau for several months. We are also seeing a higher percentage of cases being community acquired infection, and that's a term that means that people really don't know who gave it to them. And that is also challenging because one of our approaches is to do contact tracing. That's reaching out to people that have a positive COVID test, hearing from them what they've been involved in, giving them advice, and then following up on any people that they've been connected to also give them advice on isolating themselves, staying in quarantine. And when you have community acquired infections, that approach becomes less effective because you don't have that sequential set of conversations you can have so that you can really kind of stop that infection, that outbreak, if you will, that localized outbreak in its progression. So as I mentioned, we are doing contact tracing. Minneapolis does those, contacts people who live in Minneapolis and does that contact tracing. And I think when you plan ahead, we need to think about into the fall and winter, think about people who might become infected and not be able to work, but also people who are in households with folks who are infected or who have been in a circumstance where they might have been exposed. Those people are also being asked to isolate and quarantine. And so keeping an adequate workforce, I think is a challenge and something that perhaps could populate another strand of messaging. You know, if people are concerned about, gee, I feel so overwhelmed by work already, and maybe protecting ourselves as a team so that we can all be here working together might be part of a message. And then I believe that in most cases, unless there is a compelling other reason, we will be continuing to work remotely. the governor is still saying that if possible, that's what folks should do. And because we are in this high, unchanging, unmoving plateau, that kind of advice I don't think will change as we move into the fall and winter season, and feel like we have to be inside. So we might be inside our homes to the extent that we can. So I'll stop there. Plenty of themes and thoughts, hopefully, for you to chew on, and happy to answer any questions if there are some.
Yeah, and I encourage our attendees to go ahead and raise your hand if you want to ask Gretchen a question, and or add your question to chat. I thought it was interesting. You talked about message fatigue. So that must mean that you see some benefit to sort of a repetitious approach to messaging.
Yeah, I don't know. Certainly repetition, but freshness. You know, so how can we engage different sectors to take the lead, or how can we not just say the same thing over and over again, but say it with a new twist, new information. Yeah, it just becomes background noise when we hear something over and over again, and it's not all that easy to implement, or it's not that wonderful a message. So this long-standing outbreak, I think, is challenging all of us to think about how to, you know, keep that urgency of urging people to adopt the right behaviors. How to make that happen over months and months and months.
Yeah. You know, the themes you brought up are so relevant to the organizations in our network, especially keeping a workforce, and the challenges of remote work, which only work for some of our workforce and not a lot of frontline people. So that's kind of why we're getting together today too, is to have the opportunity to talk about that and how are we going to approach that, because it is so difficult. I see a couple of questions in chat, so I'll share those with you, Gretchen, in our last few minutes with you, and you can consider them. From Judy, how would we recognize those people who are contact tracers? Some in our community are suspicious of authority. Interesting.
We are actually seeing a pretty good acceptance and uptake. High 80-some% of folks are willing to talk with contact tracers, and it's through a telephone. We're not going door to door or anything like that. And so people have been trained as contact tracers to not only cover the science and the advice that they need to give and ask the questions, but also how to create trust and really approach the work as a problem solving, because each person's case is slightly different. Maybe how they acquired the disease, the infection, who they've been with. Also, their living circumstances are challenging in lots of different ways. Maybe they have social supports that can deliver food to them. Maybe they don't. Maybe they live alone in an apartment, but in a very concentrated building. Just lots of things to think through with people. And so we have found pretty good acceptance.
Excellent. Well, it's like the theme you talked about, gaining trust being such a critical component of trying to do this work together. Last call for questions. I have one more in chat. A couple more in chat, and we'll just take one more minute for these. Do we think community organizations may have a role in distribution of the vaccine?
Great question. I think we'll certainly be looking for locations. We'll be looking for partners who can reach out to community members and encourage them to come to a location, who perhaps roles right now when we're doing testing, community testing, we have partnered with not only healthcare organizations, but community organizations that bring some of their staff so that it feels like a familiar, trusted environment when people come. So I think similar kinds of partnerships when it comes to vaccine are quite possible. We'd love to hear about interests people might have.
Great. Last question before we have to let you go. This is interesting. Outside of restaurants, where are people collecting tracing information?
I'm not sure I understand completely the question. Outside restaurants.
That was my question, and I've been to a couple places, restaurants picking up food and the like, and for those individuals who are sitting down, they're collecting phone numbers for
Oh.
everybody that's in the restaurant.
Yes.
So in case there's so that they can contact people. But where else are they doing that kind of
Yeah,
collection?
That's a great question. Thank you. Many organizations have created their COVID plan as they open or reopen, or contemplate reopening. I know I have been on a committee or two with some faith communities, and as they conceive of when they might open, they have provisions about collecting the names of who came to meetings, other contact information for that very reason. And I think that that's something that community-based organizations might want to think about too, to be able to do it in a way that doesn't make people feel untrustworthy of the organization, but maybe some assurance that after a certain period of time that information will be discarded, or some guidelines about how that information is going to be used and how it's not going to be used. But that would also be very helpful if community organizations could do that, should there be an outbreak associated with their work.
Thanks, Jan, and thanks for jumping on and adding some clarity to your good question. Gretchen, we'd like to thank you, and I'd like to share a note in chat from Ann Long, our board president. She says, thanks to Gretchen and your department also for that initial guidelines booklet back at the beginning of the virus when we had no idea what to do. So we really feel the partnership and the collaboration, and we just are really thankful that you were able to come on and talk with us today and share your story. Thank you so much, Gretchen.
Yes, thank you.
Have a great day. We are going to move into our discussion breakouts just for the rest of our Zoom. We're going to work on fitting in a couple of breakouts, and my co-moderator Clara is going to distribute us into some groups. And we're going to talk in the first breakout, we're going to talk about the question, what concerns or challenges do you anticipate your organization or communities will face this fall and winter? And what's key to joining these breakouts is that when you get sent to the room, remember your room number. So you'll see it as you go and pay attention to that. And please also note that there is an Ask for Help button. So if you're in your breakout room and you need help, you have access to help. There's a Google Doc. So each little breakout group should assign somebody to jot down a few of their key learnings. We want to be able to harvest this discussion today and share and synthesize it and share back the themes and the things that we learned in the E-Goodie Bag. So if you haven't already, make sure that you open up that Google Doc for note-taking. It includes the question, and you'll see the link in chat. So as you go into these groups, make sure you are using that Google Doc. Clara, anything else right now before we go to the groups for maybe 8 minutes and then come back for just a couple minute share? Claire's on mute, but she's getting ready to send us into our discussion groups.
Yep, no, so you should have 3 to 4 people in each room. Mm-hmm. And just a reminder that you can chat me, the moderator, if you're having any trouble getting into the Google Doc, or if you forgot the question, anything like that. And we'll bring you back automatically after 10 minutes. And then we're just gonna call on maybe 2 or 3 groups to share back some of your learnings, just because we won't have time to do a full big debrief. So.
Sounds good. Are you ready to split us up?
Yep, I'm gonna be sending you to your room shortly. Just remember to catch that room number before you go into the room.
Sounds good. See you out there. Well, and thanks to everyone who jumped into a conversation and shared kind of what they've been concerned about and the challenges that they are facing, which are significant as winter comes. And also thanks for jotting notes into the Google Doc. Since we won't have time to share everything, we do want to, Clara, we're going to include some of that in the E-Goodie Bag. Yeah, so everyone will get a chance to see the full harvest, as we call it. So are we ready to grab a couple people to share back? Just a minute or two? Does that sound okay, Clara? She's nodding. All right. Is there anyone in particular that can give us a quick summary of their discussion? I could hit up group 1 on this one, group 1 and 2 maybe. Anyone from group 1 want to unmute themselves and share?
Sure. Yeah, I took notes for room 1. So one of the bigger things was like keeping up the team morale, which, yeah, just to try to still keep that up during this time when we can't really communicate face to face and check in with people. And along with that, how will the workforces be affected, especially if there's college employees? And colleges are getting hit kind of in a weird way right now. And also just bringing in new staff and trying to feel part of the team. So that we had a little chat about that, since that was me for MACC. So since I have not met anyone.
Yeah, it's interesting. We're hearing the themes from Gretchen's conversation too. There, the workforce theme.
Right. Yeah, and just how to adapt then all of your routines to just still safely distancing. Like Joni had brought up that it would be, you know, kind of like going to get a drink of water is a little different because you have to put it in your cup and you have to make sure you're avoiding people, just adjusting your routine overall to maintain with guidelines. And then lastly, communication is just a big thing of trying to keep track of what your organization is doing and making sure that you're being efficient and not duplicating efforts, you know, just trying to make sure that you're in touch enough, but not too much that it's, you know, a little bit annoying, you know, trying to be contacted every 5 minutes on what you're doing or something.
Yeah.
So.
Yeah. Thanks, Serena. How about anyone from group 2? Anything else that you talked about that you'd want to summarize for us?
I can chime in here. I ditto what Serena was talking about in terms of employee morale. We talked a lot about that being a concern, the fatigue, message fatigue, and sort of manager fatigue, trying to maintain team morale. We talked about, I think something slightly different that we talked about was concern about non-compliance with organizational policies. So some folks who are just like really wanting to come into the office, and managers really struggling with like having to constantly send people home. And then on the flip side of that, trying to think about what happens, you know, when the peacetime emergency ends and we have folks who are working remote who still don't feel safe coming into the office, or and then having employee groups or who are, you know, trying to manage those various employee groups, the folks who are essential workers and are on site, and those that are working remote, and everybody's kind of in a different place in terms of where they want to be working. And it's really hard as a manager to sort of manage all of that. But I thought that non-compliance with organizational policies was something that stood out from our conversation, that just folks that, you know, how do you over this long haul, how do you stay disciplined about the rules and making sure that everybody's safe.
Yeah. Awesome. Thanks for the couple of sharebacks. And we'll, as I mentioned, we'll include all of what people have shared their concerns. We'll include that in the E-Goodie Bag. We're going to hop right into round 2. Again, remember your room number. Click on the Google link that Clara just posted, second breakout document. Go ahead and click on that right now. And then she's going to, and the question you'll see in that document says, so what adaptations are you considering or preparations are you making for fall and winter? So we know what the challenges are, and they're not easy to resolve, but what are you considering and what are you preparing? So Clara will get us into room 2. We'll have about 10 minutes, 8 to 10 minutes again for that, and just a very brief share back, and then we'll let you go for the day. Thanks for participating in this second discussion.
Yep, and do make sure you click on the new link because it is a different document.
Yeah, I
so
see that.
The new link in chat before I send you through rooms momentarily.
Great. Question again, what adaptations are you considering or preparations are you making for fall and winter? All right. Once everyone's back, we'll take just a couple minutes for a share back, and then we'll do a little wrap up.
All right, everybody should be back.
Hope everyone enjoyed their conversation. I thought our chat was excellent. And it was good to hear what people are thinking. I think I picked on group 1 and 2 in the first round. Is there anyone from group 3 that would like to just share a synopsis of their discussion in group 3?
Sure, I can do that. I took the notes for group 3. We talked about that folks are adapting and streamlining procedures. A lot of that right now is focused on helping people to continue to work remotely, but folks are looking forward to when the pandemic ends and how we can build on those adaptations to continue to be streamlined and to do things better.
Yeah.
People talked about shifting roles and converting program models, working more closely with schools, as families tend to communicate with the schools first, and then the schools communicate with us. Talked about having to reduce capacity to allow for social distancing, yeah, so those were some of the highlights.
Awesome. Thanks for sharing from group 3. How about group 4? Anyone who jotted some notes?
Yeah, I took the notes for group 4. I am happy to go. And I am new to this group. So my name is Rachel. I work as a public affairs specialist at Second Harvest Heartland. So it's nice to see you.
Nice to meet you.
Yeah. So we, just in thinking about adaptations, we talked a little bit about not even necessarily COVID specific, but weather specific changes that we need to make. So for us at Second Harvest, we've been doing a lot of large outdoor mobile distributions where folks can just come pick up big boxes of food, and recognizing that in the winter that might be a little harder to do or to do safely. And so just trying to figure out other ways of still getting the same large quantity of product to people, but not asking them to drive in the snow and freezing cold weather. We've also been looking a little bit into home delivery options, especially for those who don't even have transportation. So that's already a challenge now. And then Jan from Darts talked about how, they have had some changes from even just the spring to the fall in terms of volunteers showing up and doing things outdoors. But the winter could be a whole different story for them as well. And then I think in general, just sort of some fatigue with people feeling like we're already making so many adaptations. We've already had to change so much, and it's really tiring for employees. And so just this feeling of constantly having to flex and meet new challenges. And so what are ways that we can make sure people are staying connected, trying to mitigate that fatigue as much as you can? What are sort of different ways of doing fun activities? Joni from Banyan Community talked about they're doing like a virtual Halloween party, or like costume party kind of, having people take pictures in their costumes and share it. So not necessarily like operational adaptation, but just what are new ways of kind of re-envisioning more fun events that we normally get to look forward to with our coworkers. So yeah, lots of ground was covered during our discussion for sure.
I love hearing that. I can honestly say I did not expect Halloween costumes to play into this conversation, and I gotta say, thumbs up, that's pretty awesome. I heard something in my group too, from someone who had been on the front lines and talked about, those challenges of cold, flu, and COVID, and which is it, and what is staff, and how to staff and clients, and how do you make sense of all that? And we don't have all the answers, but one suggestion came up was to really explore the use of pulse oximeters as being a helpful tool. So that's like a really practical thing. Like, it's not all about the temperature of the individual, and that might help differentiate between cold, flu, and COVID in some ways. So it's really all sorts of, from costumes to medical devices, all sorts of great conversation. Thank you, everybody, for having a voice in the discussion. And as we've said already, your feedback will go into the E-Goodie Bag, which will sort of be the wrap-up piece for this conversation. So thank you so much. It's been a good hour. We've covered a lot of ground. So as you're watching for that E-Goodie Bag, also keep an eye out for the next invite if you haven't seen it already. There is a Zoom coming up on October 1st that's kind of like final push, sort of last steps for getting out the vote. And we've got a wonderful speaker from a nonprofit vote organization and also a member from CAPI who's been doing the work. So we've got some an external expert, an internal expert. It's gonna be a great session. It's 1 o'clock on October 1st. So make sure you're there for that. We all need to work together and collaborate on this in the final stretch. So this brings us to the closing for today's Zoom conversation. Hopefully I haven't forgotten anything. We'd like you to consider, again, what else would you like to Zoom about? Because we are here for this Zoom platform with all of you. In the E-Goodie Bag, you'll see that link to the post-it board and throw your ideas up there. We will read them and we will consider them for future Zooms. So thank you again for everyone's participation. We are almost at the 11 a.m. mark, and so we're going to go ahead and conclude our session today. So everyone, please be well, and best wishes to everyone. Thank you so much. Have a great day. Bye.